My name is Dr. Yoni Whitten, and today I want to give you a super simple, short routine that you can use to restore mobility and maintain the health of your joints throughout your lifetime. Now, before we jump into this, I have to admit I'm a little envious of what the dental profession has been able to accomplish. Everybody knows that in order to maintain the health of your teeth and gums throughout your lifetime, you need to brush and you need to floss 2 to 3 times per day. But no such standard has been established for maintaining the health of your spine and the joints of your body. And that's what this video is going to remedy. So pay close attention if you're suffering with poor posture or chronic pain, because improving the motion of your joints is step 1 to resolving both of those problems.
This lack of understanding of the factors that lead to joint degeneration is leading us nowhere good. According to this article published in the Journal of Rheumatology in 2019, if current trends stay the same, over the next 2 decades, there will be a 284% increase in total hip replacements. And in that same time period, a 400% increase in total knee replacements. So what gives? I mean, everybody knows that if you have traumatic injuries to joints, that it speeds up the degenerative process and causes them to wear out a lot quicker. But we don't exactly have a society of super athletes that are out on a football field taking hits to the knees and hips. In fact, the cause for all of this degeneration and the need for joint replacements is at the complete opposite end of the spectrum. Sedentary living, not moving your joints enough, is the main driver for joint degeneration in modern society. That's why we're going to need so many new hips and knees over the next 2 decades. Now, according to the Journal of the Osteoarthritis Research Society, this is what happens when you don't move your joints. The joints obviously become way stiffer. The muscles in the area become smaller and weaker. The area swells up because fluid is not moving in and out of it the way that it's supposed to when a joint is being used. And that you get bony changes that are degenerative in nature. Now, if the lack of movement goes on long enough, you can actually end up with permanent dysfunction of the joint. That means it will never move the way that it's supposed to again. According to clinical biomechanics, when you stop moving a joint, scar tissue begins being laid down immediately. And that makes it even harder to move the joint. It's kind of a downward spiral. Within 2 weeks, you can see actual changes on X-ray. You can see joint space narrowing. You can see the formation of bone spurs, and you can actually see degenerative changes in the bone in just 2 weeks. So movement is the key, you guys. You've got to put every joint in your body through every range of motion it has every single day. Now, to keep this simple, I'm going to show you how to do this today for just one region of your body. But if you guys enjoy this, comment down below and I'll post similar routines for other areas of your body.
Starting out, the first movement I like to use is something called foot flips. It's a gentle motion for general mobilization of the spine and the sacroiliac joints. What you're going to do is lie flat on your back, extend your legs straight out in front of you. You're going to cross the right over left. I like to have my hands resting on my abdomen or on my chest. And then you're just going to do a slow, gentle rocking motion where the feet are moving from one side to the other like a windshield wiper. After you finish 10 to 15 repetitions, uncross, cross the other foot over, and then repeat. Just gently mobilizing those segments. After you finish foot flips, you're going to bend both knees up to 90 degrees. Once you're in that position, head is resting comfortably, you're going to do what I call knee flips, and you're just going to shift the knees from one side to the other. If any of you are skiers, this is like the motion that you would use when skiing moguls. The whole lower body moves to one side, then shifts to the opposite side. Slow and controlled, you're not flinging your legs, just gently mobilizing the lowest segment of your lumbar spine. Once you finish that, you're going to go into knee touch. Separate the feet about 3 feet apart. You're going to bring the inside portion of the knee down to the floor while this leg stays fixed. So right will stay fixed. Left knee, I try and touch this intersection here down to the floor while keeping the heel in contact with the ground. One side, then the other. This is a mobilization for the hip joint itself and a little bit more for that sacroiliac joint. Again, we're just trying to put these joints through motion every day and feed them what they need, which is motion. Once you finish that motion, come up into a seated position, and we'll go into hip flips. Again, feet are about 3 feet apart. The inside of one knee goes down to the ground, the outside of the other knee goes down to the ground. And then the opposite side, back and forth, one to the other. Now I have a video just on hip flips if you want to get into the details of this. After 20 repetitions of that, you'll flip over onto your stomach, and we're going to go straight into press-ups. Feet are going to be wide here, toes are pointing inward, hands are directly underneath the shoulders like you're doing a push-up, and you're going to press up, creating a big arch in your lower back. Keep the shoulders rolled back and down behind you so that the neck stays long. Look up, feel the stretch here along the front portion of the hip, and back down. Take a big breath in, come up to the top, exhale, let your lower back sag down to the floor. Look up, you can just rock a little bit side to side to get a little bit of extra stretch in those hip flexors, and back down. Like about 10 repetitions there. From there, you can come into a very gentle relaxation pose before transitioning into a deep squat. Here, you're just going to hang out. I like to keep the shoulders down and relaxed and just gently rotate the head from side to side. If you're very comfortable in this position, plant one hand, create a twisting motion, and reach for the sky. This is a very advanced motion. Don't try it if you have difficulty with the squat, then you'll switch down, plant the other hand, reach up for the sky. Great mobility through the shoulders, the torso, thoracic spine, hips, pelvis, everything is moving to accomplish that task. But just sitting here is fantastic. Once you finish that, you're always going to end these programs with an activation of muscular tissue. So you can come down flat on the back, extend the feet back into the position that we were in for knee flips. Head is resting comfortably. Hands will be down on the side for this one, and you're just going to contract your butt muscles and reach your pelvis for the sky. Squeeze those butt muscles as hard as you can. A strong butt will mean a healthy spine. Push up, hold for a second, feel the squeeze here, and slowly back down. Not spending much time resting on the ground, just activating muscles. The best thing about this routine is that it only takes about 2 minutes to perform, so it's a super easy thing to plug into the beginning of your day. And you're starting your day off with giving your joints exactly what they need in order to be healthy and to fight off joint degeneration. Getting in the habit of performing this routine each and every day is going to move you in the direction of that goal. Thank you so much for watching this video. If you struggle with poor posture, be sure to check out my new version 2 active traction unit. This is the most powerful form of posture training in existence. And if you or somebody that you love has been struggling with chronic pain, you've got to check out the Pain Fix Protocol. I'm going to include links for both in the description down below.